Hello, my name is Javier Luis, and together with my classmates Fatima, Daniel, and Pablo, we are going to talk to you about the acute coronary ischemic syndrome. The acute coronary ischemic syndrome is a set of heart disorders. It is caused by an imbalance of oxygen supply and myocardial demand. The myocardium is supplied by two main arteries, the right and left coronary arteries. The coronary circulation has the function of bringing the necessary amount of oxygen to the myocardium for it to function. Acute coronary ischemic syndrome is caused by an obstruction of the arteries, as in the case of atherosclerosis, or by the decreased supply of oxygen from the blood, as in the case of anemia. The main cause of acute coronary ischemic syndrome is the atherosclerosis, which is an accumulation of fat in the arteries, which cause over time an obstruction of the artery.
The risk factors for Zika for acute coronary syndrome are the same as for other types of heart disease. The risk factors for acute coronary syndrome include the following: engine, high blood pressure, high blood cholesterol, the smoking, not doing physical activity, unhealthy diet, obesity over behind overweight, diabetes, family history of chest pain, hereditary or stroke. Common causes of chest pain: cardiac, coronary artery disease, aortic valve disease, pulmonary hypertension, mitral valve prolapse, pericarditis, idiopathic hypertrophic y subaortic stenosis. History of high blood pressure, preeclampsia, or diabetes during pregnancy.
The hospital treatment general care and immediate handling from admission. The patient must remain in bed with continuous monitoring with ECG. It is reasonable to administer supplemental oxygen in the patients with sick assessed during the first 6 frame start time. In advanced patients with chest pain or other symptoms subjective of the ACS, a rapid clinical determination of the risk of obstructed coronary artery disease be defining where you have a low, intermediate, or risk or high risk to determine management in patients with suspected ACS with the presence of ischemic heart disease. If the 12-lead ACG serial and cardiac biomarkers are normal, a street or drug test should be performed to induce ischemia either in an emergent department chest pain unit or externally within the next 72 hours as an alternative to the patient's hospital admission.
After clinical study, the electrocardiogram or ECG is the study of greater relevance for diagnosis, treatment, and pursuit of the patient who undergoes some of the presentation of the acute coronary syndrome. The diagnosis sensitive is the conditional one of the moment in which it is made and by the presence of symptomology, whereas the foretell evaluate is supported by the type of electrocardiography alteration, the magnitude and the location. The electrocardiography changes that are seen in the infarct no-Q are negative difference in the ST horizontal and persist less 1 mm. And the pre-constant and symmetric inversion sequence of the T wave without presenting alteration in the QRs, so the diagnosis must support tests with cardiac enzymes. The cardiac enzymes are CPQMB. Is out.